Hello, I'm Charlie Brown with Baker-Welman Brown Insurance. At Baker-Welman Brown, we're a family-owned insurance broker with more than 85 years of experience helping individuals navigate the ins and outs of Medicare. In this installment of our Ask the BWB Expert video series, we're going to look at the parts and plans that make up Medicare. For example, you may have heard the term Medicare Part B, or you may have noticed that Medicare plans are sometimes offered through different insurance companies. So what exactly is a part and a plan when it comes to Medicare? Well, I like to say that the parts are the big pieces of Medicare that are federally funded or federally administered using our tax dollars. Plans, on the other hand, are where private insurance companies get involved in either the financing or administration of Medicare. Now, as I mentioned, Medicare is made up of a combination of parts and plans. The two biggest parts, Parts A and B, have been around since Medicare began in 1965 and have remained largely unchanged. Part A is inpatient hospital coverage, so it covers you when you spend the night in the hospital and in certain situations for skilled nursing care. It is typically covered at a zero premium, meaning there is no monthly cost to you. However, to qualify for the full benefit of Medicare Part A, you must have worked and paid into Medicare for at least 40 quarters or 10 years and be at least 65 years old or qualify under a spouse's record. If you work less than that amount and therefore did not pay into Medicare, then there is a premium for Part A. Now, like anything government related, there are some exceptions where you can qualify for Part A before age 65 due to certain types of disabilities. Now let's take a quick look at Medicare Part B. Part B covers outpatient services. These are things like doctor's visits, blood tests, x-rays, outpatient therapy, outpatient surgery, and certain types of durable medical equipment. Unlike Part A, Medicare Part B is only partially funded by tax dollars. This means you will be required to pay an additional premium to receive any of the services I just mentioned. Now, unlike traditional health insurance, Medicare Part B premiums adjust based on your income. So the higher your income, the higher your premium. Of course, how the government decides what your yearly income is, especially if you're retired, and what your premium should be, can get a little complicated. So that is a topic we will discuss in a future video. That brings us to Medicare Part C, often referred to as Medicare Advantage plans. And this is where things get a little complicated. Unlike Parts A and B, Part C is a bit of a hybrid between the government part and private insurers plan. In Part C, the government teams up with approved private insurers to create a variety of different plans to help you get the services you need. That means these private insurers will administer the benefits provided by Parts A, B, and our next topic, Part D. Part D is a big one for a lot of people and gets a decent amount of attention because this is a section of Medicare that covers prescription drugs. Now, similar to Part B, Part D is going to have some funding from the government and some out-of-pocket costs for you. Of course, what drugs are covered and how much you'll have to pay out of pocket for those drugs changes quite frequently and is often a hot topic of conversation in the halls of government. Suffice it to say, when you're 65 or older, the cost of prescription drugs is important, and Medicare Part D is a key factor in the Medicare plan. You can get Part D coverage as a part of a Medicare Advantage plan, or you can purchase it as a standalone policy. So hopefully this gives you a basic understanding of the different parts of Medicare. Now, when it comes to actual policies and coverage, that is something we will discuss in another video. As always, if you have questions or need assistance with your Medicare decisions, you can always feel free to reach out to us at Baker-Welman Brown or visit our website at bwbins.com. Thanks, and we'll see you in the next video.